your skin, you need to know this, okay? You're going to have your client to come in, lay face down with her robe and hooked in the back. Okay? You can ask them if they're cold. If they are, you can wrap them up to their waist, but if they're not, then just leave them like that. The first thing I'm going to do is sanitize my hands. I'm going to do a light brush on her back. And the reason for the light brush on the back is that gives you a chance to touch your skin, her skin, give you a chance for her to get comfortable. They may not have ever had a Bacial before and they may not know what's going on, but it gives you a chance also to see if there is anything on her back that you need to tell her. We're not doctors, but we can tell them, hey, you got a mole here that it's in question. I would go talk to my doctor about this. You don't, but I'm just on that. Okay. So I've checked at her back. I've brushed her off. This also gets rid of dead skin cells and kind of loosens it up. Okay. All right. Now I'm going to put on my gloves. And the first thing that I will do would be to cleanse her back.
You need this stool? I was just trying to get a better angle on it.
Here is my cleansing cream. You should never put your fingers into a container. You take it out and put it in your hand, but do not put your hands in the container. That is unsanitary. I'm going to add a little bit of water to it. I'm going to work it up in my hands. And I'm going to apply it on her back. You're actually just cleansing the back right now, so just go around in circles, cleansing her back all the way up. Back down. I'm going to do this about 3 times. So everything that you do to one side, make sure you're doing it to the other side. Okay. I've cleansed it. You don't have to cleanse the back but once because we do not wear makeup or anything like that on our back. Get your towel out. Make sure you check it. Make sure it's not too hot. It's not too hot to me, but it still could be too hot to her. So drop it on the back. If you see them flinch, then you know it's too hot because they'll automatically kind of flinch if it's too hot. You don't really want to talk to your client right now. You want to let them rest. Bacials really are more for relaxation. Now we do have a few people that have breakouts on their back, so they may want to get a Bacial to help with the breakouts, but most people come for relaxation. We do not have massage here. We can only manipulate products. Okay. The next thing I'm going to do is to exfoliate her back. Most of us don't get an exfoliation on our back. Most of us don't have anybody to do that to us, and it's kind of hard to reach our own back. So it feels real good to exfoliate her back. Now, when I use the nylon products for the Bacial, the honey scrub is kind of hard to get off, so I mix it with a little bit of cleanser and water. Okay, and I'm going to distribute this across her back as well.
Missy, do we have products in the treatment room or the dispense for them to do these Bacials?
I don't know if we do at this time. We did have some, but I don't know how current it is.
But we can make some more if need be.
Yes, we can make a kit.
Okay.
When you're going to use your brush, and which you are always going to wet your brush before you put it on the skin. You don't want it to scratch the brush, so you put a little bit of water on it, and you go around in circles. This really feels good, but don't get it so wet that it drips down the back. You don't want to be laying there and feel water running down your back. That's not comfortable, and you will not relax. Now, if it starts getting dry, which it is, I'm just gonna bring it over here and put a little bit more water on my brush. You can tell when it needs more water because it'll drag. Same thing with the brush. We are going to go over the back 3 times with it as we did the others. It's getting dry again, so I'm going to re-wet my brush. And I'm just going to go back down. It's normal for someone to get a little red because you are exfoliating that back. Someone that gets red real easy may have sensitive skin. That was something that a lot of times it's checked on the consultation card, but I see a little bit of redness on her back. Do you have sensitive skin?
Not really.
Not really?
That's on my back.
Okay. Believe it or not, this feels really good. Y'all are gonna want to do this on each other. Okay. I'm through with that step. Now I'm going to take another towel. The bad thing about doing Bacials is it takes a lot of steam towels. There are hot towel machines in the private rooms, but let me tell you how important it is when you finish with your hot towels and you're done. At the end of the day, you're going to take the hot towels out. When you take the hot towels out, discard them into the laundry. Then you're going to dry that steam towel cabinet out. There's a tray at the bottom. It's right down here. I want y'all to take it out. It'll have water in it. Clean it, and always leave your towel warmer open. It will harbor bacteria with it closed because bacteria grows best when it's warm, wet, and dark. So that'd be a perfect place for bacteria to grow. So always leave your towel warmer open when you're not using it. So the next thing I'm going to do is, this is a special Bacial. If I wasn't going to do a special Bacial, I would skip this part in the paraffin. But I'm going to show you all the way through. So if you're going to do just a basic one, then you do not have to do a mask, nor do you have to do paraffin. Okay, you're going to mix a little warm water with your mask.
Yeah. What was yours? Were yours tapen?
If you spill it on the floor, make sure you wipe it up. Okay. Now we're just going to paint this on. That was cold. I just saw her jump. So my water wasn't as warm as it should have been to make that warm.
Now it's warm.
Huh?
Now it's warm. You're welcome.
The mud mask is great for the back, especially if you have breakouts, because the mud mask is, this mud mask is from the sea, and it'll help to pull out impurities out of the back. So somebody that has a back that's full of breakout or zits, this will help to calm it back down. So just paint it across the back. Then something that you should have already have opened these before you start, because they're harder to open. But you're gonna lay this gauze over their back. Most of the time, about 4 will do it, unless they have a wider back or a longer torso. I usually have a towel that's draped over her back, so y'all need to do this. So you have it over her pants so you won't get anything on the pants. Okay, then you're gonna just open this up. Put them on there. Now, if you work for yourself, you'll probably have your own paraffin bath in here, but I don't, so I've got to go get paraffin to paint on her back. This is not for a